Hi, I'm Kashish and I go to Worcester Polytechnic Institute and I'm going to be a sophomore in the fall.
Hi, I'm Julia and I go to Widener University. I'm going to be a junior in the fall. I'm the class of 2024.
Nerve blocks are increasingly important in the medical community as they help manage pain from surgery or from amputation, or can help manage chronic pain, acute pain, and long-term/short-term pain. Ultrasound imaging helps guide the nerve block to the nerve in real time as it provides with real-time visualization. Nerve block phantoms are vital to be able to practice this complex procedure, but they're expensive and inaccessible to most. So, how can we create a nerve block phantoms that is both accessible to low-income communities and is functional to the user? Well, we decided that we need to replace the main materials used in a nerve block phantom block with low-cost items. This will require a gel substitute for the actual structure of the nerve block phantom and the construction of nerves inside the phantom.
And we also thought about things like the cost of material, accessibility. How accessible would this be for people who are in low-income areas? And how difficult it would be to manufacture and create. And after having a lot of discussions as a group about what we wanted the product to look like, we decided on using agar gel, but in our model, gelatin replaced it because it was more accessible for us to get. And we used angel hair pasta, and we used thin balloons. All of those things are relatively accessible to get, we thought. Then there's the development of the product. We read some previous essays which used things like ultrasound gel, some type of animal part, like chicken breast, or a hot dog, or a pork loin, wire, angel hair pasta, and balloons, which are two things we both use, and we chose some materials we thought would be relatively inexpensive for people to buy. We ultimately decided to have the ingredients sold as a nerve phantom kit instead of just selling the nerve block phantom itself. So I put the angel hair pasta inside the balloon and then inside of the gel to make this model. Now the gelatin seems to hold together as a gel really well.
There are several advantages and disadvantages to this product, as the gel doesn't need refrigeration, maintenance, or supervision, and it is not toxic. It's also easy to make and reusable for up to one time after a single use. All materials are readily available in rural and low-income settings. It doesn't interfere with ultrasound base or ultrasound gel and is extremely low cost. However, it does need to be constructed on-site with instructions included in the kit, and is not able to simulate multiple tissue layers, which creates a dissonance in reality versus phantom. The cost analysis for this gel would be around $5 USD for one block, which is around 450 ml for a standard agar gel powder, $2 USD for one box of angel hair pasta, and around $12 USD for 100 pack of pencil balloons. Some limitations include the accuracy of the nerves as according to the manufacturer's ability. While we can include instructions in the kit, it is ultimately up to the customer to construct the phantom. We have not factored in cost and price differences from countries beyond the USA, which is one improvement we could make. Other improvements we could also make are more accurate models for nerves and other systems to simulate in this phantom, which could include different materials. We can also add a low-cost ultrasound as a package so that the customer has everything right in front of him.